Hello and welcome to episode 2 of VetPhysioLife. I am Shane Jasani and I'm joined once again by Kim Sheader. Hi Kim, how are you?
I'm good, thank you very much, yes.
Very good. Kim, I thought we would start by talking about the patients that you saw yesterday. So can you briefly remind us who they were and what they had wrong with them?
Yes, so I started by seeing a elderly Weimaraner who had just some arthritis and is just getting a bit old and needs a few knots worked out of his muscles and to help him keep as active as possible. He was doing quite well. We did some laser with him as well as various other bits and pieces, and we started some exercises to see if we can get him a bit stronger on his back end. Then I saw a post-op having a dog that had a TPLO, so a operation for cranial cruciate rupture. He's now about 8 weeks post-op and he's starting to do a little bit more. He's had x-rays and they're very happy with all his bone healing, etc., etc. So now it's just his owner guide him through the strengthening exercises that he needs to do and sort of progressing how much activity he can do on a day-to-day basis, and encouraging him to use the leg as much as possible. And he's progressing all right. He needs to do a few more exercises, but his owner had been on holiday and life always sometimes intervenes with these things, but yeah, she's going to get on it properly now, so that's all good. And then the final one I saw was a greyhound who had a neurological problem, which means that they're quite ataxic, so that just means very wobbly, basically. Looks a little bit like they're drunk when they're walking is probably the best way to describe it. And because of that, she gets quite a lot of tightness in certain areas because she's having to sort of hold on for dear life even when she's walking along flat ground. And then in other areas, it isn't working her muscles well enough. So we do a combination of sort of exercises and lots of soft tissue release and lots of joint mobilisations to keep her as comfortable as possible. And it was all good. And
do they know what her neurological signs are from?
Yeah, she contracted neospora a while ago, and this is left over from the infection. Yeah.
Okay, fair enough. I'll include a line about what neospora is in the where we share.
I'll let you do that one.
Yeah, no, that's all right. No worries. So I guess when we do these episodes, we're going to come back to some of the same things many times, but I think that's totally cool because obviously they are common. What I wanted to ask you today was that could you possibly just tell the listeners a little bit more about where the cruciate ligament is, what it does, and how it can get injured?
Yeah. So the cruciate ligament is one of two ligaments the cranial cruciate ligament, more exactly, is one of two ligaments in the canine stifle, which is the equivalent of knee. So it's one of the joints in the back leg, and it's the dog's knee, but in vet speak we call it a stifle for whatever reason. I'm not entirely sure why. In humans, we have an ACL, and people may have heard of lots of sportsmen, especially footballers, that damage their ACL. And the cranial cruciate ligament is exactly the same ligament, but within a dog's knee instead. So they have a cranial cruciate ligament and a caudal cruciate ligament, where humans, we have an anterior cruciate ligament and a posterior cruciate ligament. All these two ligaments do is they're cruciate ligaments because they cross over and form a cross form, so that's where the cruciate name comes from. And all they do is prevent too much movement of the femur, the top bone, the thigh bone of the knee, moving too far forwards or too far backwards in relation to the tibia, the bottom, the shin bone of the knee joint. So it's just to help the stability of the knee or the stifle joint. And unfortunately, the cranial cruciate ligament in dogs can get quite a bit of abuse, especially if they're a very active dog or do a lot of jumping, especially. Jumping up is the big thing that can put a lot of stress through them. So there are two different things can happen. You can get a partial tear of the cruciate ligament, or you can get a complete rupture. Either way, they can cause quite significant levels of instability, which means that the dog will then get pain in that joint and won't be as active and won't want to use the joint as much as you would like them to. So they can have a number of different operations, TPLO being just one of them, to help reorganize the anatomy of the joint a little bit. It just helps changes the biomechanics of the joint to just help it make it more stable. They don't put the ligament back in or try and repair it because they found that doesn't work very well. But there are other operations, other techniques that can be quite useful and can give back good function.
And Kim, do all dogs need to have surgery if they injure their cruciate ligament?
No, not at all. There are some dogs that, for various reasons, may choose not to have, their owners or carers may choose not to have surgery. Some, certainly if it's just a partial tear, may find that physio and strengthening can do, and they don't need to have surgery anyway. And some, even particularly large dogs, and not particularly, maybe not active, maybe a bit older, then again, conservative management with physiotherapy and strengthening and maybe some hydrotherapy can do wonders, and surgery is not necessarily a 100% certainty or necessity.
Excellent, fantastic. And I'm going to change tack completely, because I know that you and I have spoken before about the fact that you sometimes end up having to do some of your paperwork on the weekends. And given today's Saturday and tomorrow's Sunday, could you just help give the listeners a little bit of context, I guess, in terms of what the paperwork requirements are around you seeing patients, just to give them some idea of, what you have to do?
So every single dog I see and every single time I see them, I write notes for them. So I will write a little bit about anything I've discussed with the carer, how the dog's doing, how they've progressed, how they or haven't progressed, anything they're particularly finding difficult to do or not, or, just in general what's been happening with them. Then I will note down my findings of my assessment. So if it's an initial assessment, just start from scratch and go through everything and look at range of motion of each joint, look at muscle bulk, look at are there any areas that in the muscles that are particularly tight and sore, look at all the joints and look at and feel how the joint play, how it feels. Does it feel stiff? Does it feel sore? Does it feel normal, etc.? Note all of that down. There are various special tests depending on what the problem is. So I might look at the neurology of the dog, see how their proprioception, so their knowledge of where their body is in space, basically, is sort of the easiest way to describe that. And various other tests that I might go through depending on what the problem is. Then I'll note down what my treatment was and what any particular techniques and how if there was any particular response to those techniques, and what exercises I've given the carers to do with their dogs as a home exercise program, and then my analysis, what I think is going on, what I think is they're doing well or why they might be struggling with something, and then my plan as to when I want to see them again and what I want them to do in between times. So that I do for every single dog, every single time I see them.
Wow.
It's quite busy.
Yeah.
And then I'll do reports to the vets as well. So I need to, certainly after the first time I've seen a dog, and certainly after the last time I see a dog. So if it's something like rehab from a cranial cruciate ligament, you would hope that you don't end up seeing the dog forever. So when you discharge them, when you've got them better, you give a discharge report to the vet just so they know exactly what's going on. It's so important to keep a good communication between the primary vet and the physio, because after all, the vets have referred them to me. and we should be part of the same team looking after the same dog. And if I do see a dog for a long time, or if I'm likely to, like some of my older clients who are going to be ongoing and I'm probably going to see possibly for the rest of their lives, then I will send interim reports every now and again, every sort of couple of months, say, to the vets, just to let them know if there's been any progression or if there's been any changes. And if there's any sudden changes, then obviously then I'll write a report as well. So just, lots of communication is the big thing, but you have to note it all down, obviously.
Yeah, and your point that I know you're always keen to stress about the fact that it's a collaborative effort between the primary care vet and the physio, right? It's not a sort of handoff of care from the vet to the physio.
Absolutely not. Absolutely not. I've got my areas of expertise. I know how to be a physio. The vet knows how to be a vet, and they've got their areas of expertise, and we should be working as a team together, not as two separate entities. It works by far better that way. I spent many, many years in the NHS working in conjunction and as a team with doctors and nurses, and it should be just the same within the veterinary profession as well.
Excellent, fantastic, Kim. I think I'm gonna let you go. We'll wrap it up, but I know you'll love this because my cat's basically come and jumped and sat on my keyboard whilst I was talking to you. She's sitting right in front of me, staring at me. I'm like, okay, great. Thanks for your time, and have an awesome weekend, and we'll hopefully speak again on Monday.
Brilliant. Okay, that sounds
Take
good.
Care, Kim.
See you. Bye.
Bye.